Hey, Floys. Welcome to another episode of the Sporadic Flow podcast. We're so excited to have you with us here today. So just going to introduce our host in case you are a newbie here and this is your first time joining us. I am Teresa. I'm tuning into you from Texas. I always say, hey, girl, hey. Hey, guys. Welcome to the Sporadic Flow podcast. I'll go ahead and pass it on to Miss Ebony. She's also in Texas.
That's right. Hey, Flowies.
And our other host is Miss Z, tuning into the Sporadic Flow podcast from Ohio.
Hey, Flowies.
Welcome. So, we're so excited to have you with us today. Today, we're going to be talking about IBS, which stands for Irritable Bowel Syndrome. And we'll go ahead. I'm going to pass it on over to Miss Ebony. She's going to start us off and just let us know what it is.
Right. So we have a little different flow today. I'm going to start us off. So IBS, Irritable Bowel Syndrome, is a common condition that affects the stomach and the intestines, and it's also called the gastrointestinal tract. Symptoms include cramping, belly pain, bloating, gas, diarrhea, and constipation, or you can have both. IBS is an ongoing condition that needs long-term management, and only a small number of people with IBS have severe symptoms. Some people can control their symptoms by managing diet, lifestyle, stress. So this is going to be real near and dear to our hearts because one of our little flowies has IBS. And I didn't want to go because the overview actually touches on what we're going to be discussing. But I just figured we'll let Miss Teresa tell us a little bit more about IBS. And then if you're comfortable, you'll share your experience.
Course, of course. So yeah, like you said, there is two different types of IBS, or I guess maybe three if you want to consider both. But yeah, you either get diagnosed with IBS constipation, IBS diarrhea, or you can have both. So that's why I said I guess three different ones of them. I have constipation. Wonderful. Lovely.
Yeah,
So
you.
some of the symptoms that you may have with IBS is belly pain, cramping, bloating, that's related to like passing stool, changes in the appearance of your stool, and changes of how often you are actually passing stool. So it's mostly like stomach discomfort when you're eating and just kind of like the whole digestive process. I have always had issues with my digestion, like always, like since the beginning of times. That's always like all I remember. So I honestly don't know if it's something I've had like since birth or if it's something I developed just because since I mean, I remember when I was a little girl having to get enemas like because I would get backed
Mm.
up. And so I honestly don't know if it's just something that's always been there or just got diagnosed later on in life. I know for me personally, I have a lot of stomach discomfort. There is sometimes that like I'll be out eating and like I'll go in looking snatched, and within like 30 minutes of eating, I look like I'm like 7 months pregnant. And I'll just be like, man, my stomach hurts. And I'll just be like, like I always tell I'm like my parents laugh because I'm like, dude, I can fart on command whenever you need me to. Like I'm always
Oh,
gassed.
That's good to know.
oh,
I might need to have used that.
this.
I feel like I'm
So
always
our own
gassy.
living,
Like
breathing whoopee cushion.
Oh my
yeah, and
gosh.
like people when they get embarrassed like about farting and stuff, and they try to blame it on me, I'm like, it wasn't me. I'll tell you if I farted. So don't ever think like I'm trying to slip something in or like, no, I'll tell you like I got to fart. Like, girl is gas. And I'll even do a courtesy. I'll be like, roll down the windows, everybody. I'm sorry, I can't hold
Oh
it
my
in, but
goodness.
like
Wow.
it very rarely happens. But I'm like, if somebody farts and you're like, who did it? It wasn't me because I would have told you it was me. Like
Okay.
just a little out there.
You said
So
that you said that you had it when you like can you remember as far back as when you started having those pains? Like what age? Like was it early on in your life? Like
that's what I'm
how?
like. I don't remember my age, but like I remember like pretty much ever since being in school, like having stomach issues. Like, and that's what I'm saying. Like, I remember I was really young, maybe like 5, and my mom was like having to give
Oh.
me enemas because like I would get so backed up. It was just like cement coming out. Like, yeah, it was bad.
Wow.
Crazy. And
So
see, with me, I would say that I have irritable bowel syndrome, just having this discussion, only because I've always had a problem with constipation, but no stomach discomfort, no bloating, and things like that. But if I don't take something to poop, I won't. And I know your body can become acclimated to it to where you take it on a regular basis so much that when you stop, you can't go, but that's what has happened to me. So I always have to have something, some kind of Kyola greens or some kind of stool softeners or something now that I'm here in
Mm.
Texas, down in the valley, to make me go, and it helps me lose weight and detox. Otherwise, I won't go. And I've literally been hospitalized for being full of stool. So I don't know if that's considered IBS, but I don't
you
have any of
probably
the other
do. And that's what the thing, like, yeah,
undiagnosed, maybe.
yeah. And like, because I didn't get diagnosed until I was an adult. And it was just like, I went to a GI doctor and I was just like, man, I'm always bloated, my stomach hurts. And they were like, oh, you have IBS with constipation. And I was like, oh, I was like, I probably like had this all my life. And to me, it was normal because it's what I grew
Right.
up with, you know?
I heard
Hmm.
a
It's,
doctor say that too, that it is very common for people to go undiagnosed. So I think
Yep,
that's
and that's
true.
probably what happened. Yep. But I can
yeah.
remember, like, my mom was always giving me raisins to eat. And she always kept a pack of, this is who you was talking about TMI before we started recording, a pack of plastic knives under the sink. Because a lot of times it would be so thick and big that it would clog the toilet. So she would come in the bathroom before I flushed and
Wow.
she would cut it up so that it would go down. Or always, like, I learned how to use a plunger at a very young age. But the last time I was hospitalized was the same day that Whitney Houston died. I was literally full to my armpit with poop and started having chest pains. And my homegirl Tiffany thought I was having a heart attack or dying and rushed me to the ER. And yeah, I was literally
Wow.
full of,
I've had the chest
yep,
pain. Those, it sucks.
yeah, you don't know what's
Yeah. It's
going
like air
on.
gets trapped and then it's like,
Hmm.
yeah, taking a deep breath in is just like that sharp jolt of
Yeah,
pain. And
yep, I
girl,
was
I think you have
getting.
IBS and you just haven't been.
But I do regularly. I have not been hospitalized since 2011, February 2011. So
Yeah. See,
I
and
have it
I've
controlled.
never gone to the hospital or anything for it.
Really?
I probably should have at some points, but just being the person I am, I'm like, happens like this. Like I've literally gone, I think the longest I've gone is 3 weeks without any poop.
And we know, being nurses, three
What?
days, we're like,
Really? And so I
okay.
know your stomach was like
See?
hurting, and
And that's the thing though, like it's
were
so
you stressing because stress can have an
Mm-mm.
effect, but you weren't going to the bathroom. That wasn't an alarm for you or your family?
it
Like,
was so normal for me that I just like it's normal for me. So I'm like just like you don't
oh
phase
my
it. And like
goodness.
I get like, like you get so backed up to you get to a point that I have to take laxatives and just like clear out my system and like do a reset. But now being a nurse, I realize I should do it more often, like not wait that long. But
Hmm.
yeah, I have gone 3 weeks without nothing coming out and eating.
Crazy. And I can't recall the longest I've gone. Now that I think about it, it was just, I remember I had Burger King. That was like, I guess probably like my stopping point. And I was taking out my micros, and I had to go to the wig store to buy wigs because I couldn't even finish taking my braids out because my stomach hurt so bad. Tiffany finally took me to the ER and they did CAT scans and stuff and started IV. First time I had IV morphine, and that made my stomach pain worse. But that was the last time that's happened. So I now watch and make sure that I take something. And honestly, I love to poop. I can honestly say I enjoy it because I know what happens when I don't poop. But I never had no gas, like no bloating. I still, flatulence is fine. That's good. You've got that peristalsis and all of that. But I don't, I can eat without my stomach hurting unless I eat too much. But I don't have any of the other symptoms you have, just the
And that's so weird.
constipation.
I was
Hmm.
gonna say that's the weird thing. Even with going 3 weeks without pooping, I can still fart and everything. Like,
That's crazy.
It like the air go around it.
yeah, I guess my body's just like so used to it. It's just
Used
like,
to it.
it has made its makeshift GI system. It's like, you know what?
Your body been compensating for this long. They like, we got this.
Yeah. And then some days I have like really sharp pains, and I'm like, what it is it's like old stool that's moving. So you may see me like, ugh, like,
Are these
or an arm.
periods of time when you're eating on a diet or anything like that? Like, are you on a diet? Did you see a gastroenterologist? Did they?
I saw a GI doctor. I honestly, like I said, I can't remember when I was an adult, but I can't remember what year it was or how old I
Mm,
was when I got diagnosed. So I did go to a GI doctor, and that's when I found out. And it's my mom is the exact same way. So,
okay.
and I guess that's what to me it made it normal because like my mom had issues. So I was just like, oh, I have my mom's stomach, like, and my mom has IBS too. So yeah,
Wow.
so to me it was just normal. Like this is what our family deals with.
Hmm.
So
That's
yeah,
interesting.
yeah.
Oh,
So
that's so sad because I could just at 5 years old and your stomach hurt, is this such a young age to be having that type of pain and issue? I had the
yeah.
opposite. I was over there having urinary problems, but I could hold my urine forever and never have the urge to go.
Oh
So
wow.
and I
Still
still
drinking
have to
water too?
drink water.
Get out of here. You girl, you how big is your bladder?
That's what I be saying. Like, how big is my
Wow.
bladder? And I still have to, like, sometimes if I drink, I have to be like, I have to go to use the bath. Like, I have to train myself to go, but
So you can use the restroom, you just don't have the sensation of
I
having to
don't
go.
have this sense. It just, and so yeah, I got a UTI young, around that age. So
Mm,
it's crazy when growing up at that young age, you trying to navigate, figure out this world and there's stuff going on with your body. So, but I can imagine
yeah.
having like pain, abdominal pain in restroom. Oh my gosh.
Yeah. Okay, so now I'm thinking about it. I'm backtracking because I was
Okay.
doing I'm like, I was doing home health when I got diagnosed. So it would have been about almost 10 years ago
Mm,
when I got diagnosed. So I mean, a full-blown adult by that time. So yeah. And so for me, like, okay, so I went to the doctor, got diagnosed. Of course, right away, they put you on medication.
mm.
First, they said fiber. I don't know if there's something with IBS and fiber. Ebony, do you take fiber?
I do.
Does it
I
make you
don't
poop?
like it. That will
It
make me
forms your
bloated.
poop. It
That
helps
makes
form
me
your poop.
bloated. I
Okay,
noticed.
because I was like, when I take fiber, I just get bloated and
Yeah.
I produce more
Mm,
gas.
Yeah, and I do like a spirulina, or like I'll notice a lot of my herbal capsules will have like spirulina in it, and that aggravates my stomach. But it doesn't
Okay.
give me, diarrhea, but I do get the bloating, and it does increase the I want to say flatulence because you're like farting.
Flatulence.
Yeah,
ah,
increases my gas.
my gas.
Yeah, because I
Mm,
was gonna say they always like, oh, increase your fiber. But like for me, fiber makes me so uncomfortable because I get so bloated. My stomach gets so tight. It doesn't produce poop for me. Like
Yeah, I
it
think
just
that would be for
produces,
people with diarrhea, right? You would think.
yeah,
You
it's
would want the stool to be more formed versus
yeah.
it breaking down so you can move it easy.
mhm.
See,
Yeah, it does not make me pass poop.
and see if this is like backtracking when Z said she's just the opposite. I thought she was going to say she has diarrhea, but then she said hers was urinary. So
Yeah, I'm over
that's,
there in the other area. Yeah.
yeah, yeah, you from the
Yeah.
front. Okay. But yeah, I think, yeah,
Can't
fiber,
urinate.
but I do
But
Yeah.
love plums
did
and I love prunes.
well, yes, prunes is definitely gonna help move it around. Yeah,
You just like eat like a dried
I
prune?
love so girl, they have even the individual, like the little smart ones,
they
like
work.
little plastic can and stuff. And I love when I was a kid, a lot of things I didn't like, but as an adult, they're a good healthy snack. But I love prunes and that will help keep me regular and I don't have the gas. If I drink prune, my mom would always do prune juice. When she
Mm,
needed a cleaning out, is what she would say. That just fills me up with gas. But if I eat the actual prune, it's gentler on my stomach. So I don't know. So I'm like, I have to do stuff to aggravate my stomach, and it's usually something that'll make me poop at some point, depending, on what
Yeah.
it
Yeah.
is. But I love them. I think prunes taste so good.
I
I
don't think
love
I've ever
prunes,
had one.
raisins, grapes, plums.
I don't know if I've ever had a prune, to be honest.
Really? I love
Yeah,
them.
I'm not for sure.
Aren't
It's a dried up plum.
that's what I was gonna say. Have you
It
eat
sounds like
plums?
they look like a big raisin, right?
Yeah, they do.
Yeah.
Yeah, they do. Like
And
the
then they
plums,
also
if you
have
get them,
dates.
yeah.
I've just recently had my first date when I was in Costa Rica last
Really?
month. I had
Okay.
never had a
Okay.
date
And
before.
then they have figs, but
I've had a
Mhm.
fig before. Yeah. Okay. Yeah. So, I mean, of course, go the natural route if you can, but I prefer more natural things. When I did go to the GI doctor, of course, that's where I was going with this story. I got sidetracked. Of course, they prescribe you medication. They
Mhm.
put me on, can we say medication names? Is that going to be like,
a flag.
yeah. So they put me on a medication that is very popular that starts with an L. um, and let's just say it got things going. And the reason that's why I was like, now I remember I was doing home health. Were you gonna say something?
Well, I'm thinking, isn't that they use that for like narcotic induced, like if you take a lot of pain pills to
It's
help with.
for IBS too. Like that's one of
Oh,
the.
and see, and now you didn't say the name. Now I want to know if it's the same pill. Just tell me what the first letter and the last letter, or what it
It's
rhymes with.
L and S.
I know what. Okay,
Yeah,
LIN.
yeah.
Okay,
Uh,
So
I'm like, I'm too
I'm like, I
nosy
don't want
for her to just
anybody
say it
getting
starts
after me
with an
about
L.
saying like not promoting their drug.
Right,
Um,
right, right.
right, right.
but yeah, so I started on that, and my experience was it turned me completely opposite. So I
Mm.
went from somebody constipated to somebody who had like I couldn't hold it anymore. I
Yes.
literally took the medication. I would get about a 10-second warning I needed to go. And wherever I was, it was coming out. Like it was no like this is your
Dang.
there was no 2-minute warning. There was like, and we're coming out. And
Wow.
it was not formed at all. It was coming out like water. So there was just like no holding it. So I told my doctor, I was like, dude, how can I be doing home health, taking care of patients, and I'm over here having accidents on myself?
Right.
Like
Mm-hmm.
and I was like, I can't
They're
do
gonna tell
this.
you you
So
need a home nurse now. Some
I was like,
diapers
I
or
can't do
something.
Ooh,
this.
that's a
Like,
good one.
Wow.
yeah, I was like, that's what made me think. It
Mm.
was when I was doing home health because I told her I can't do this. And she was like, oh, your body will get used to it. It'll adjust. I
No,
think, yeah, I think I took it for about 3 months because, I was like,
it's a long
Wow.
time.
yeah, I was like, let me test this theory, see if
Trooper.
it works. No, it was like, I finally, like, I just stopped seeing the doctor because I was like,
Yeah.
forget this. Like, and normally it worked pretty quick. Like you take it in the morning. I want to say it was like on an empty stomach. Normally it would work pretty quick. And like, on the days you plan it, like, and you get up early enough and you can, okay,
Yeah.
fine. But the days it didn't kick in right away, and I'm already out here seeing patients, and all of a sudden I get that little trigger warning,
And you
like,
funking up the back of the
Not a
McDonald's.
trigger warning.
I mean, you get that little like
Wow,
He
we're
said
about to
a
go. It was like,
crazy.
and it wasn't like, we're about,
Mm-mm.
like, oh, we should find a restroom now because you're gonna
Yeah,
probably need to go within the next hour. No, like I had seconds.
that's crazy.
Yeah, it
that
was bad.
is.
Yeah. So my crazy story I was telling you that I was gonna tell you before, and this is if TMI, if you're like get grossed out, don't listen to this part. So one day we're at home, my husband's in the shower. I got my little warning, like it's time. Being the respectful, nice wife that I am, I'm like, I'm not gonna kill him in the bathroom when it's steamy in there and he's in the shower. So I'm like,
Uh-oh.
yeah. And my son, I want to say, was in the other shower. So I'm like, whoo, babe, can you hurry it up in there? And he's like, yeah, yeah, yeah. Like, so I'm sitting here waiting, waiting, waiting. And I'm like dancing, like trying to like, whoo, hold it in, hold it in. Then I'm like, you know what? If I let out a little fart, maybe it'll like give me a little room to like
That's the saying right there, boy.
Uh, Me and my bestie, we always say is you can't trust a fart.
Mm,
Mm, mm,
mm.
mm.
Girl, by the time he got out of that shower, I crapped all over myself. Like, yeah.
Oh,
And I like what I did, I was still in my pajamas, so I cuffed the bottom of my pajamas so like it didn't come out. Like I grabbed it and like kind of made a tourniquet at the bottom because
hmm,
it was just water. It wasn't like formed.
That's
yeah.
crazy.
Yeah.
Look
So yeah.
at she
And I'm
all
sitting here thinking, I'm
invested.
like,
She
man,
invested.
was the floor carpeted? Was it tiled? I'm hoping it wasn't carpet.
I
Did
don't
she
even
have
remember
enough
at this
spots?
time.
You
You
know,
gotta
went
have
to the
as much
carpet.
absorption.
I don't even remember at this point, but I caught
Really?
like I cut off like the bottom of my pants, like I tied it so tight so it wouldn't leak out. Ugh, it was
Yeah, that's
horrible.
too
Like, and that's
deep.
my story why I
Oh,
stopped going to the GI doctor. I immediately stopped that medication because I was just like, at least this time I was
yeah,
lucky enough I was at home because I
Hmm.
can't even imagine if I was somewhere else and that would have happened to me. Like, I would have been like
yeah.
demoralized. Like,
Yeah, that's crazy. I would give that like I did home health as well, and a lot of our chronic pain patients that was on narcotics would have to get that. And let me tell you, one lady, she was from Brooklyn, and she, was living here in San Antonio, smoked cigarettes like a train, was a pack rat. But let me tell, and she had ulcers. She was a diabetic, had multiple things going on, chronic pain. So that was one of the medications. And if her pills, if she got down to like 10, she was, the other nurse was here. I need my pills and all of this stuff. But yeah, like she would be camped out, and she had a bucket, and we ordered a bedside commode. And she would have the bucket, she would have the bedside commode, and then she had the bathroom, because sometimes, and she only had one bathroom. So if her husband was in the bathroom, she either has to
Yeah.
use the bedside
see, I
commode
needed a
or
bed. I
the
should have asked one
bucket.
of my patients, like, are you using a bed? It's like, oh, it looks new. Can I just go ahead and take
Yeah, yeah, like
You mind if I just have
seriously.
this?
Right,
it was
right.
bad. Like to me, I don't know. That was worse than the constipation, or at least the constipation. Like if I get to the point where I need a laxative, I can plan around it and like, no, I'm
It's
not
gonna
going
be
out
my
today.
poop
Like
day.
I'm gonna be home. Like we're cleaning out today.
Hmm.
Is there anything that helps? Exercise or anything at all?
Not the bloating and discomfort part, but drinking water like actually helps me move it faster. Like,
Hmm.
so, but the bloating and actual pain part, I can't really think of anything that helps on that. But I try to do more natural stuff. You know what's actually really good, and I haven't done this in years, but would help me a lot is Spanish black radish.
I've never heard of that.
I was taking that and I was pooping like a baby, and it was formed like regular poop, but literally I eat 30 minutes later I needed to poop. Like that's why I say pooping like a baby because it was like scheduled. I knew I ate 30 minutes later I needed to poop. And it was foreign poop, it wasn't watery, and it kept me regular.
Wow,
I never heard of that.
interesting.
Yeah,
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 you
I'm
get
gonna
it
look that
like
up.
at Sprouts or what is the other
really.
one? Whole
Like
Foods.
okay.
Yeah. And
Good
it comes in
info.
a capsule. I think
Okay.
I was getting mine online. I forgot about that, but that did keep me regular now that I think about it.
Because I was going to ask you if it, how did it taste? But if yours was in capsule, like I wonder
Yeah.
if that, it sounds like a vegetable, I guess, because of the radish part.
Yeah. It's in a capsule and you would
Really?
take it like
Okay.
maybe I can't remember if you would do it like 30 minutes before or 30 minutes after you
Mm.
eat and then you just drink water and it kept everything flowing.
Mm. Now,
So,
Z, that makes me want to ask you, like, what's some risk factors that go along with IBS, and even the risks if you don't have a bowel movement? I
Some
think that's
risk factors if you don't have a bowel movement, I couldn't imagine the pain, first of all.
a bowel obstruction.
Oh my goodness. That would give me, I mean, I would feel, that's why I was asking you, Teresa, like, how did you feel? Like, were you stressing that you didn't go to the bathroom? Because that is a risk factor, having anxiety, depression, or any other type of mental health. So, um, on Mayo is talking about Mayo Clinic. It states some sexual, physical, or emotional abuse history. That's interesting. Also might be a risk factor.
And you know what? I've always wanted, I need to do research on that because I do remember like when I first went to the doctor, that was the first thing she asked me was like, have you been sexually abused? And I'm like,
Mm.
what is that? Yeah.
Yes. Hmm.
That is something very
And it's like,
often that
how would they tie that together? Is it because I
the
know with
way,
like little kids, if kids usually have been sexually assaulted, they have accidents on themselves, or they'll
Mhm.
hold their urine, hold their stool, and then become constipated. But
yeah.
you being an adult, sometimes, and we was talking about TMI, sometimes anal sex can either constipate you or cause you to have diarrhea. You're not able to control your sphincter.
Mm-hmm. Yeah.
That's,
So
I
yeah, I
wonder
do
how
remember
that
they asked me
sexual
that and I was
assault
like, what in
ties
the
into
world?
it.
And you said that word perfectly, Eb.
What?
Just a
Which one?
sphincter.
Oh,
Thinker.
I'm
You
telling you
said
because when
that with every
uh,
pronunciation as I
the
ever heard.
the
Yes,
first
girl.
time I've learned about the sphincter muscle, I went to school for medical assistant. I went from 95 to 97, and one of my classmates loved anal sex, and she had to wear a depend like a brief because
Oh
she
no.
had no sphincter muscle control because her and her
See, and I
husband
see,
anal.
I
Yeah.
feel like my sphincter is like overly tight just because of my issues that I've had. Like I'm like, I feel like that,
With
like
tight booty. Okay, that's a good thing. That's a good thing. I mean, we usually normally just do Kegels, but
I feel like my mom looks at me because like sometimes we'll be in the store and I'm like, oh, I need to use the restroom. And she's like, do we need to go? And I'm like, no, my sphincter is like good. Like I think I can hold it. Like, and my mom's like,
but that's hey, well, that's good. That's good to know. And you'd have to
Oh
have a good
gosh.
one like that. Well, hers was shot. And you gotta think about it. That was after high school for me, and she was older than me. And the funny thing is, I went to school with my older sister, and we still laugh about the freaks we went to school with. She was a freak.
see,
The teacher was a freak, and but yeah, that was the first time I learned about the sphincter. And then my instructor was like, "Okay, well, that leads us because we was on the GI track. Now we're going to talk about why she has to wear a brief because her sphincter muscle,
Oh.
the booty hole, and you
it's
have
your
sphincter
sphincter.
in your
Yeah.
body, but that was our exterior sphincter, is your rectum
Oh my
booty
goodness.
hole. So
Yeah,
Is
I'm
that
very
a
familiar with the sphincter.
she
Like,
said
I think mine's
sphincter.
is, I think she's pretty good. Like, she's been tried too many times, and I think she's like adjusted, and she's like, "Girl, we gotta learn how to hold this." Like,
Hmm. That's good. That's good. Good to know.
you like that my sphincter is tight?
Yeah, that's good. Good. Because hers
thanks
was
for the
done.
Oh my
clarification?
goodness, Z back there laughing. I cannot.
Oh, Eb gonna say hers is shot. What
Yeah,
do you mean?
it's done. And I'm pretty sure they do resections by now, or repair surgery, plastic surgery
Mm-hmm.
on the butthole.
I'm
I
sure
would
they
not doubt it.
do. I'm
I
Yeah.
sure they do because I've seen. I don't. I mean, this was on Instagram, but I saw a guy who was having that repaired, and I'm pretty sure that's why. Like,
really,
yeah.
wow. And I'm sure it wasn't as common back then because you got to think this was 95, 96. And so
Hmm.
fast forward, I have not spoken to her since school.
Mm-hmm.
you know. So hopefully, if she's still alive somewhere floating out there in this great big world, that she since had her sphincter. What would it be called? A sphinctoplasty? Or
Oh my
what's
goodness.
the
Ooh-wee.
term?
I
Right?
don't even
Plasty
know.
is to repair. I think
Yeah.
Yeah, yeah. Oh my.
sphinctoplasty. I don't know.
Because then I'm
Oh,
like, is she just gonna bust it
coin it.
again? Like, if she,
And then the doctor's going to say, look, ma'am, we've already repaired your sphincter 4 times, 3 times, two, we can't do it anymore.
Mm.
Then it's, non-repairable. But yeah, absolutely. And I thought that was weird. So that's something that's always stuck in my head related to sphincters. Like, okay, they do get worn out.
Hmm. It says that you, and I heard you say, Teresa, that your mom has it. It says having a family history of IBS. Genes may play a role in that.
Hmm.
Is you said, as far as you know, it's just you and your mom?
I know my dad has stomach issues too, but I don't know if he's actually I don't know if he's actually seen a GI and been diagnosed with IBS, but he has issues with constipation too. My brother has issues with constipation,
Mm,
so I guess just growing up in a household like that, like it becomes a norm, you know?
Bunch of
yeah.
tightwads, for real. That's
Thanks, Eb.
They say it's more common in
good.
females, but men can get it too. But I've also seen studies where it said that both it's just it's undiagnosed. I mean, you really could never really know. That just would be so hard. I would just wonder how it affects people daily activities. Like, if you have to take the bus to work, or you got to work, or stand on a line, or
I gotta walk. Hold over
For
here.
me
and what?
personally, it
Mhm.
doesn't affect my ADL or my
You ADLs right there.
She
activities of
she
daily
making
living.
sure.
I was like, wait, what is the actual, what is it?
ADL, yes,
It
ma'am.
doesn't affect that for me, not that much.
Not that much. Okay.
On the medication, it affected me a lot because I
Mm,
had to like plan my day about when that time was going to come. But on a
mm.
normal, like, not a lot. I mean, I still can function. Like, I may have days that I'm like, oh, I'm uncomfortable. I need to clean out tomorrow, or oh, like my stomach is bloated. But I mean, I still go about my day.
Okay.
On 3 weeks.
I just can't imagine. I'm really just like, wow, that's a very long time to not have relieved yourself, in that way.
Yeah,
I would almost be scared to eat. I'd be scared, like, how is that happening? It's amazing. I know we have long tubes, intestines, like, but I'm just like, for 3 weeks?
One
it just
good
shows you what
person
my
I
gut is
know.
used to because I wasn't even like uncomfortable. I wasn't like,
I wonder
yeah.
how colonics would work with that.
I think my mom has done it.
I have.
And I want to say it didn't, nothing happened. And the lady was like, that's weird.
Well,
Like,
I'll
I
say
want to say it like didn't produce a result.
really. I was in the hospital, so I've only been hospitalized twice for being full of poop. The first time was after I had Daniel. I was a teenager, and they actually admitted me, and I was at Good Samaritan Hospital in Dayton, Ohio. And they had to clean out my colon so that I could have a colonoscopy. And I'll tell
Mm,
you, that was the most uncomfortable because they give you go lightly so that you can
mhm.
get that full cleaning until it's just clear coming out.
I
If
don't know
they
why they
mix it
call it
with
lightly.
Gatorade, huh?
I don't know
You
why they
got a
call it.
cat now?
That's what I
Yeah,
was about to say.
I'm trying to keep them off my laptop.
Have
But
you always had a cat?
no, I just adopted.
Oh, okay. Okay. How many
No, I was gonna
dogs
say I don't
do?
know why they call
Oh,
it
I'm sorry.
lightly.
Look, now I got other questions. Okay, I'm sorry.
I don't know why they call it go lightly
I
because that ain't
digress.
a light go.
Mm,
Too funny.
But I had that just so that I could have the colonoscopy so that they can get a full picture of my colon. I can remember fighting with the radiology. I don't know if it was the tech because they filled up my rectum and wanted me to lay flat. And I can remember having chest pain. And I told them I couldn't lay flat on my back. I couldn't lay on my side because when I lay down, I would do like that. And I couldn't breathe from the pain because they fill up your colon so that it'll show up on the screen. And then and I remember after they got me back to my room, I called my mom, and my mom came up there and was about to blow the place down. She was so pissed off, but I was crying. But then they put the tube in reverse and it sucks everything out. So you feel this, and I swear, like I had liposuction way back then. Like they sucked it all the way out. Then when I got back to my hospital room, then they had to give me we used to call them like the milk of the chocolate and like the milk of magnesia enemas
And enema?
to clean me out because then the solution will constipate you and whatever little bit of stool is left will turn into cement. So my
Um,
butt, you want to talk about not being able to sit down, having the donut to sit on because I can't put any pressure on my rectum. That was the only, I guess I'd say that was the only hospital admission. But then in 2011, I went to the ER, but they didn't keep me, thank God, because I'm like, look, I'll take some Miralax, some enemas, some Colace, I'll take laxatives, X-Lax, whatever. I don't admit me because I remember that. And that was bad. And actually, I was like, well, pretty much we done cleaned you out. You're clean as a whistle. But mind the procedure started out with the Go Lightly, and I had to drink this like a gallon that they make you drink. I was almost like wanting to throw up because it would make you so sick before you can even. And now being a nurse, and having to have making sure patients are drinking that because you got to have your procedure, you got to have this test, and they don't want to drink it. I'm like, I've taken it before. I know it tastes horrible, but we need to clean you out. But
Yeah.
that was my little poop story. You got any poop stories? I feel like we sharing on a level that's not normal right now.
We're
See,
getting intimate here.
that cat is just walking past the
I know
screen.
that's why I'm trying to keep him down. Z, you're on
So
mute. Are you okay?
cute. So cute.
Oh, yeah.
Um,
He doesn't, whenever I sit down at my desk, he feels like he needs to be involved. And I'm like, I
so
need you
cute
to
and
calm down.
little too.
See this long tail go past.
No. But the intestines are like between, it said 10, 15, 20 feet, 20 feet long. And I'm just thinking it's like a chitlin. You just want to like take it out and just like
Mm.
push it all out.
Teresa's like, chitlin.
uh,
And girl, my mom bought him last weekend, so the time is coming. It is approaching.
That will approach.
my
Mm.
goodness.
I would
Mm-mm.
think a
Mm-mm.
big risk factor to not having a poop, which I don't see it here on the Mayo Clinic, is a bowel obstruction.
Yeah.
You know what I mean? Like not pooping. It's not. So if anybody's watching this, is not good and it's not healthy and it's not safe to not have a bowel movement because it will, if you
Yeah.
run the risk of it rupturing. And then if you have
You gotta have
stool that's
surgery and
spewing,
get septic and
end up with a colostomy bag, or you know what I mean? So
hmm
always make sure that you are using the bathroom. And then we're on the floor, we're doing bedside care. We usually don't let the patient go more than 3 days without having a bowel movement before we giving them something that'll get them going. So always want to make sure that make sure that you're urinating as well.
it
Yeah.
can actually obstruct and you have issues urinating too when you have too much poop.
Right. Yep. Yep. So a lot of
Yeah.
a lot of backlash, no pun intended,
Yeah.
for
So
not having a regular bowel movement. But I couldn't imagine the irritable, and then hearing that it could be diarrhea or it could be constipation or both.
Mm,
And I wonder
mm-mm.
if it's the diarrhea because of the medications that they give you, like you experience. Have you go from one extreme to the other, so to speak?
I think it's just natural diarrhea. Like me, I get constipated. I think some people eat and they can't keep it in.
And see, and that made me think like when you get your gallbladder removed, having
Mm,
that part of digestion, that kind of
mm-hmm.
like overflow.
Hmm
Because I know my sister and my mom both had their gallbladders, my niece as well. And as soon as you eat, it's like you got to make a beeline for the bathroom because it goes straight from here and it goes down and it's coming out your butt. So there's no wait period, you know?
hmm
You have irritable bowel syndrome because you've had an organ removed.
I
Yeah.
wonder with so much constipation, do people have like hemorrhoids? Is that an issue?
I would think
I
so.
would think so. I personally don't, but I would think so.
All that
Mm,
straining and pressure. And it's easy
yeah.
to rupture, you know what I mean? And depending on how big
Mm,
the hemorrhoids are, sometimes, you panic thinking, and sprung a leak back there and you bleeding out. And it's
mm.
just because your stool coming out, and, popped a hemorrhoid.
Hmm
But then let
Yeah,
people
I have
know
not
that's not
experienced.
normal.
Have not experienced hemorrhoids yet.
That's
So.
good. I've had it. Mine was only because of birth,
Hmm
Mm.
but that was it.
Yeah.
But not from being constipated.
Yeah. So just on to keep going too. So when you should see a doctor is when you're noticing that you're having some persistent changes in your bowel habits or other symptoms like that we have spoke about of IBS. If you're having weight loss, if you're having diarrhea at night, rectal bleeding, iron deficiency anemia, unexplained vomiting, pain that isn't relieved by passing gas or stool. So if those are symptoms that you're feeling, it's been kind of ongoing, definitely consult with your doctor. Your primary care doctor probably will refer you to a GI, a gastroenterologist, to have it checked out and looked into. But yeah, definitely something you want to um, look into.
Hmm.
And I want to say too, if anybody has had, we all experience stress, but on here it says that stress can cause IBS, or you having a severe infection that can also cause gastroenteritis, and IBS also might be associated with the surplus of bacteria in the intestines. And I'll tell you guys, I love prebiotics and probiotics. I try to take care of my gut health because I know that's where I'd say all of our problems stem from. Is if you
Mm-hmm.
have an unhealthy or unhappy gut, that can lead to a lot of other things. And it's like other things can also affect your gut. So
For
very,
Yeah.
sure.
very good discussion. And I'm glad. Did you have it under control now, Teresa? Do you think manageable?
Manageable.
Manageable.
Hmm.
I don't take medication because I mean, if that was my option, yeah, where are you doing that? So
Mm.
I don't let myself go 3 weeks anymore. Like, just I manage it. The
Okay.
the bloating, the discomfort, I mean, that's always there, but the
I'm sorry. Your
it's
kitten is so
okay.
cute playing with your ear.
No.
And you just
But
talking through it like it's nothing.
because he's like always in my business, like but the pooping part, I mean, I can control better, I know when I need to clean out and yeah. So
Mm.
I would say I just manage it.
Okay, okay.
Okay. I wish
Any
you the best
thoughts?
with that.
Thank
Thank you.
you. I
Thank you. Thank
appreciated the
you.
show. Do you have any other
Yeah.
thoughts, Lee?
No, I
No?
just make sure you continue to see your doctors, and I wish everyone out there who has this the best as well. Yeah.
I think this was a very
Mm.
hearty and a very lively discussion. And Teresa, I want to thank you for being so open. And you also helped me to open up about my GI problems as well. So that's the goal, I think, to get people to be in a place, a safe place where they're comfortable enough to share, because you're
Yeah.
never alone. You never know who can relate. But we try to make it lively. You have to learn how to laugh at yourself and be comfortable with it, because also laughter is good for the soul. So thank you for sharing your story, and that helped me discuss my bowels as well.
Yes, thank you,
Of course,
Teresa.
of course.
Yeah, yeah.
Okay, well, ladies and gents, thank you for joining us for another episode of the Sporadic Flow podcast. I just want to watch the replay to see the way she was laughing over there. That's cracking me up.
Y'all two crack me
Uh,
up all the time.
don't forget to catch us. You can watch the replay on YouTube. We're on our Facebook page. We have a website it'll be uploaded to. We're also on Spotify, pretty much on social media. We're going to be under the Sporadic Flow podcast. We'd love to have you comment, give us your feedback. Let us know. Do you have IBS? Do you know somebody with IBS? Do you have some recommendations, maybe of things that are helping you deal with it, whether they're medications, whether they are natural things? Let us know. Maybe we can share some tips and tricks of things that have helped us or that is helping us manage it a little bit better. So, until next week, we want to thank you for watching and
Thank
have
you
a
for
great
tuning
rest of
Stay
your
in.
safe,
week.
Please check
everybody.
out www.sporadicflowpodcast.com. We are on all social media website and podcasts from Ebony, Teresa, and Lee.